Welcome to my YouTube channel. Our today's topic for discussion is clinical use of commonly used medicines. In today's topic, we will discuss drug information, mechanism of action, side effects, and considerations for these medicines. In today's discussion, we will learn treatment therapy of Digoxin, Insulin, Methotrexate, Levodopa, Dabigatran, Fluoxetine, Entecavir, Propofol, Metformin, ACE inhibitors, Statins, Warfarin, Colchicine, Tetracycline, Allopurinol, and Alendronate. Today's discussion is very much important for all healthcare professionals. Now let's move to our topic. Our first medicine is Digoxin. Digoxin is used for various heart conditions like atrial fibrillation, atrial flutter, and heart failure. The occurrence of adverse drug reactions is common. Owing to its narrow therapeutic index, symptoms of digoxin poisoning includes vomiting, loss of appetite, confusion, blurred vision, changes in color perception, and decreased energy. Insulin. Insulin is an injectable protein hormone that is used as a medication to treat high blood glucose. Different insulin products have different half-life, with the longest-acting ones being insulin glargine and degludec. Inhalable insulin is available in the market but then discontinued due to lack of acceptance. Methotrexate. Methotrexate MTX is a chemotherapy agent and immune system suppressant used to treat cancer and autoimmune diseases. Common side effects include hepatotoxicity, leukopenia, and stomatitis. Folic acid can to reduce some of the side effects of methotrexate, and thus commonly prescribed together. Levodopa. Levodopa or L-Dopa is an amino acid precursor of dopamine and is the most effective and commonly used drug in the treatment of Parkinson's disease. Levodopa is almost always given in combination with the drug carbidopa, which prevents the nausea that can be caused by levodopa alone and also enhance the action of levodopa. At first, levodopa may be taken with a meal or a snack, so that any effects like stomach upset will be lessened. Dabigatran. Dabigatran is an anticoagulant used to prevent blood clots and to prevent stroke in people with atrial fibrillation. The most commonly reported side effect of Dabigatran is gastrointestinal upset in case of severe bleeding. The action can be reserved by antidote idarucizumab. Fluoxetine. Fluoxetine is a selective serotonin reuptake inhibitor SSRI that used to treat major depressive disorder MDD, obsessive compulsive disorder OCD, and other mental disease. Serious side effects include serotonin syndrome, which characterized by high blood pressure, fast heart rate, and fever. Studies shows that it may increase the risk of suicide in people younger than 25, so it should be used cautiously. Entecavir. Entecavir is an antiviral medication used in the treatment of hepatitis B virus infection. It reduces the amount of HBV in the blood by reducing its ability to multiply and infect new cells. It is recommended to take it on an empty stomach at least 2 hours before or after a meal. Propofol. Propofol is a short-acting medication that results in a decreased level of consciousness and a lack of memory for events, and it is commonly used in starting and maintenance of general anesthesia. Common side effects of propofol include an irregular heart rate, low blood pressure, a burning sensation at the site of injection, and the cessation of breathing. US FDA has issued an emergency use authorization for Propofol 0.01% to maintain sedation via continuous infusion in people greater than age 16 with suspected or confirmed COVID-19, who require mechanical ventilation in an intensive care unit ICU setting. Metformin. Metformin is the first-line medication for the treatment of type 2 diabetes. It is advised to take after meal. Common side effect includes diarrhea. ACE inhibitor. ACE inhibitor is for treating hypertension, heart failure, or slow the progression of chronic kidney disease. It is contraindicated in pregnancy and severe allergic history angioedema. Patients may experience drug cough when taking this drug. Statins. Statins are lipid-lowering drugs that reduce illness and mortality in those who are at high risk of cardiovascular disease. It is contraindicated in pregnancy. If patients are taking simvastatin or atorvastatin, it is advised to avoid taking grapefruit juice together. Warfarin. Warfarin is an anticoagulant used for preventing stroke. Patients who are on warfarin requires iron or monitoring regularly. It is advised to avoid cranberry juice and do not overintake dark green vegetables while taking warfarin. Colchicine. Colchicine is a medication used to treat gout and Behçet's disease. Long-term prophylactic regimens of oral colchicine are absolutely contraindicated in people with advanced kidney failure. It is advised to not take colchicine together with grapefruit juice. Tetracycline. Tetracycline is an antibiotic used to treat a number of infections. It is mostly contraindicated in pregnancy and children less than 8 years old. It is advised to take it 1 hour before or 2 hours after meal for best absorption. Allopurinol. Allopurinol is a medication used to decrease high blood uric acid levels. Patients should drink more water to prevent formation of kidney stone. Genetic testing of HLA-B 5801 allele can help to detect the risk of Stevens-Johnson syndrome. Alendronate. Alendronate is a bisphosphonate medication used to treat osteoporosis and Paget's disease of bone. Patients is advised to take it on empty stomach before breakfast and swallow whole with full glass of water. Patient needs stay upright for 30 minutes and not eat anything in the next 30 minutes.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.